Greetings. Thank you for this invitation to participate in Longevity Day Nigeria. My name is Ilyas Tambler. I'm a board member of the International Longevity Alliance and a Chief Science Officer of VETEC, the Movement for Longevity and Quality of Life in Israel. I think it is my fifth or sixth time that I participate in the Longevity Day Nigeria. Thank you for organizing it. Thank you for bringing the topic of longevity to public attention in Nigeria. My topic is longevity activism around the world, also in Africa and other places. Why is it important to be engaged in longevity activism? First of all, a little bit of science. What are we talking about when we talk about longevity? We basically speak about intervention into aging because we understand that if we intervene into degenerative aging processes, we will be able to prevent multiple age-related diseases because aging is the main risk factor or underlying cause. We see this clearly with COVID-19. The most vulnerable people are elderly. Recently, we also published a position paper about it. So if we really want to fight the COVID-19 crisis, we really need to improve the aging process to improve health and longevity. There are many proofs of principle that it is possible to intervene into aging and increase health and longevity. This is, for example, the classification from the NIH, from the US National Institute of Health, about the main processes of aging that can be targeted. And there are many proofs of principle that by targeting them in animal models, in some emerging human trials, it is possible to prevent diseases and extend longevity. Now it is our goal to activists to help bring those therapies from the lab to the clinic to all of us. Also, it is very important, besides therapies, to develop biomarkers of aging because you cannot treat something that you cannot diagnose. It is also an important area of research. I am myself involved in both of these branches, both therapy and biomarkers research. For example, regarding therapies, recently we published, co-authored with Chinese colleagues, a paper showing that a well-known anti-aging treatment, the mesenchymal stem cells, can actually help to reduce mortality in severe COVID-19 cases by calming down the cytokine storm, by improving the balance of the immune system. So this once again shows the connection of aging and disease, that it's possible to use anti-aging treatments to fight diseases, also infectious diseases such as COVID. And also we try to be involved in bioinformatics with my colleague, Dr. Bloch, developing information theory-based biomarkers of aging and age-related multimorbidity, published several papers, included this topic into the European Partnership on Active and Healthy Aging. Also very important to develop measurements of aging, measurements of age-related ill health, not just to predict diseases, but also to test the effectiveness of treatments. This is basically the scientific tasks of longevity. Uh, who will benefit from improved longevity therapies? Everybody, the society, the economy. We know that by postponing age-related disease, we can save huge amounts of money, save the healthcare and welfare system, but also basically to save health and increase the quality of life of every person. It is not just for the sake of the state we do it, but for our own sake for each and every one of us. Who will benefit from it? Everybody, the general public, and who should be involved in it, who should promote it. Also pharmaceutical industry, medical technology industry, health insurance, regulators and policymakers, scientists and students, all should be interested in preventing age-related diseases, in improving health and longevity. Many people think that longevity, the issue of longevity is not very relevant in Africa because generally the life expectancy is low in Africa. For example, in Nigeria and several other countries, it is just over 50 years, the life expectancy at birth. But we need to understand that the general therapies that help to increase life expectancy, also help increase longevity. The life expectancy in Africa is increasing about 8 months every year, which is a very rapid speed. So the population is aging in Africa very rapidly. And also in absolute terms, about 80% of non-communicable age-related diseases are happening in low-income countries, including Africa. So aging and age-related diseases are also a very important problem in Africa, and will become an even greater problem as time goes by. And if we really want to improve the quality of life in Africa, and also the Human Development Index, we need to think about increasing health longevity in Africa as well. So we understand the need that is an important topic, that we need to improve health longevity by intensifying scientific research on it. How we do it? Well, as with every social movement, if we believe that something should be done, we advocate for it, we educate for it, we create a social movement. Basically, we become engaged in social activism. And the same for the longevity movement. For the longevity activism, we need to become advocates, we need to become activists, we need to explain to people why is it important to deal with it, to invest resources in it. And advocacy and activism can be done on many levels. At the international level, we can study the international policy frameworks and bring those frameworks to the attention of decision makers. For example, the WHO frameworks, like global strategies for active and healthy aging, also the program of work that now includes healthy aging. It is important to bring this topic to the highest level. Also at the national level, there are certain policy recommendations that can be made to governments. For example, this is an example of our position paper with the International Society on Aging and Disease, that argues for the critical need to promote research of aging, to improve health longevity for the population, and include some recommendations such as improving funding, improving incentives, social support for the aging field. And these are recommendations that are universal, can be used anywhere in Europe, in Africa, in Nigeria, in Israel, everywhere. They were translated to 12 languages, submitted to several governments. So this is the kind of policy that can be advanced at the national level. But the main unit of advocacy is an NGO, non-governmental or non-profit association. This is where most of the activism is organized, and where most of the activities originate. For example, in our Israeli association, we try to increase education awareness about longevity, to increase communication support, for example, organizing conferences, analysis and data processing of the kind I mentioned earlier, to find the predictors of health longevity. So that's just our association. Similar or additional work can be done elsewhere, but it is very important that if we really want to improve longevity activism, we need to build up associations, non-profits. I hope more pro-longevity associations will also emerge in Nigeria, because this is the basis for any awareness raising, for any community building. And of course, we don't need to wait for the government to adopt this policy. Each one of us can advance health longevity by our own means, be engaged in research, study relevant fields, join others with similar interests, participate in research, volunteer, just lead a healthy lifestyle, to be able to benefit also from more radical longevity technologies when they're available. So the need for activism is clear. The things that we can do is clear. Has it worked? What are the results of our advocacy and activism so far? We must be honest, we could do much better, but still our movement is very young, and there are many obstacles it has to overcome. but still we have some positive developments. Here are some examples. For first of all, the longevity months that this event is a part of. Very important events have been organized in dozens of countries, hundreds of events, hundreds of promotions. This longevity month of October is really an excuse for us all to bring the topic of longevity to public attention. They could be position papers, they could be conferences. All this was done with some success, and their actual results of this advocacy work. We were able to actually improve policies even at the global level. For example, at the WHO, thanks to our advocacy campaign back in 2017, the WHO included aging as a part of its work program. It wasn't there. So this really shows that longevity activism can be influential. Also, the development from the ILA work to include aging as a part of the International Classification of Disease as a modifier also shows that it is possible to change public policy in favor of health longevity even at the global level. And here at the national level in Israel, we also do our best to improve policies, to advocate for health longevity, to increase research for health longevity. For example, we included the topic of health longevity research into the Israel Master Plan on Aging. The result, there were several calls for research proposals, which is a very good mechanism to engage the scientific community in longevity research. But it's never enough. The more research is done, the more labs are established, the more treatments are trialed, the more biomarkers are trialed, the faster we can advance to our goal of health and longevity. And I do hope that thanks to all our involvement, thanks to all our research and all our advocacy and activism, we will reach this goal as soon as possible for ourselves and for our loved ones. Once again, thank you very much for organizing this, and I hope to be in touch and to cooperate in longevity advocacy in Nigeria, in Africa, and in the future events. Thank you.